AED Familiarization Training Program created by HeartZap Services. Let's take a look at the heart structures and functions. The heart pumps oxygenated blood to the body, and then the body sends the deoxygenated blood back to the heart. The heart pumps the blood that is very low in oxygen back to the lungs to be reoxygenated. The lungs send the freshly oxygenated blood back to the heart to be circulated throughout the body again. There are electrical impulses that send a message to the muscles to contract. Together, they work in conjunction to pump oxygenated blood throughout the body. If the heart's electrical patterns are irregular, it may disrupt the regular pumping action of the heart. The abnormal electrical patterns are called arrhythmias. One of the arrhythmias is called ventricular fibrillation, which is essentially when the electrical activity is making the heart quiver. There's another arrhythmia called ventricular tachycardia, and that is essentially when the heart is beating too fast to be able to pump blood effectively throughout the body. This is where the AED comes into play. Defibrillation is required to reset the electrical activity of the heart. The AED is used to reset this activity. Survival rates in people who are experiencing cardiac arrest have been increasing over the years with the use of CPR and AEDs together. This is why AEDs are available for public use. With the use of an AED and high-quality CPR, the chance of survival increases to between 30 and 70%. With every minute delayed in using an AED and CPR, the casualty's chance of survival decreases to between 7 and 10%. The units that you have in your location are the Cardiac Science G5 AEDs. They're very easy to use, reliable, and safe. All you have to do is press down on the white latch, which will open the lid and turn on the AED, and follow the prompts. When the AED is turned on and the electropads are attached to the casualty, the heart rhythm will be analyzed and the rescuer notified if shock is advised or no shock is advised. You only use an AED when the environment is safe. Do not use it on a severely injured casualty, and only attach an AED on a casualty that is unresponsive and not breathing normally. HeartZap Services provides medical oversight for your AED program. AEDs are designed to determine the best treatment for a casualty. If the casualty is not breathing or is gasping or has labored breathing, the AED should be activated, and if safe, the electrode should be attached to the casualty's bare chest. The AED determines if a casualty needs a shock before starting each 2-minute interval of CPR between analysis. If no shock is needed, CPR will be recommended. If a shock is needed, the AED advises the user to establish scene safety and push the shock button before resuming CPR. Let's get orientated to the G5 faceplate. There's a connector for electrodes. This is where the electrodes are connected to the AED. The electrodes should be connected at all times and ready for a rescue. When the electrodes are connected as shown, the AED can identify the pad type and the expiration date. The latch. Pressing down on the white latch will open the lid of the AED. Once the lid has been opened, the AED will turn on and begin to provide instructions on the next steps. The electrode indicator. The electrode indicator will light up when the pads are improperly connected to the AED, cold, dried, or damaged, or detached from the patient during a rescue. The function buttons. The right function button can be pressed to change the language prompts from English to French and French to English at any time during an AED rescue. When you press the left and right function buttons together for 3 seconds, the AED will go into diagnostic mode. Smart Gauge Battery Status Indicator. The green LED lights on the Smart Gauge display the capacity of the battery. As the AED is used, the LED lights turn off as battery capacity decreases. When the green LED lights are all turned off, the red battery indicator will illuminate, indicating that it's time to replace the battery. Information display. This is where the rescue prompts and CPR countdown timer is displayed. Number of shocks delivered and rescue time is also displayed. Shock button. This will light red when the AED is ready to deliver a defibrillation shock. Rescuer is to press the red light to deliver therapy to the patient. Service indicator. This indicator lights when the AED detects a need for maintenance or service. Should this occur, please contact HeartZap Services Inc. to troubleshoot the issue and make arrangements to receive a loaner AED if required. Rescue Ready Status Indicator. When the status indicator is solid green, the AED is rescue ready. Rescue Ready technology assesses the AED, battery, and pads to ensure they are ready to perform a rescue. If the status indicator displays a red X, the AED is not rescue ready and it has failed its latest self-test. The Cardiac Science G5 AED has a rescue ready status indicator that is green when operational. It tells you that the AED has done an internal automatic check. It does this every day. The check ensures that the AED is ready for use, the batteries are good, and the electropads are attached. If you see a red X and hear a beeping noise from the AED, this indicates that the self-test has failed, which could mean new batteries are required, the electrodes are not attached, or the AED requires service due to a malfunctioning operating system. There is one IntelliSense battery at the back of the unit. Once installed into the G5 AED, the battery will operate the AED for 4 years from date of installation. The IntelliSense battery has an installed before date on the back of the battery. The battery can deliver up to 420 shocks. If a red X is displayed in the status indicator, and the battery indicator on the inside of the AED unit is red, then the battery requires replacement. To replace the battery, turn over the AED so the back of the unit is facing you. Press the Battery Compartment tab and lift out the old battery. Replace with a new battery that hasn't passed its install before date. Insert the new battery into the battery compartment and press down until you hear a click. Once you hear a click, turn the AED over and check the Rescue Ready status indicator, as it should have turned green. The adult defibrillation pads used by G5 AEDs are unique, as they are two-piece electrodes that can be placed in either position on the casualty chest. The defibrillation pads are very easy to use, as they have pictures on them to identify how and where to place them onto the casualty. These pads are good for 2 years. The expiration date is on the outside packaging that can be viewed from the pad expiration window located on the lid of the AED. Each Cardiac Science G5 AED comes with an AED rescue kit that is attached to the hardened shell carry case. The AED rescue kit includes a CPR mask, a pair of disposable gloves, disposable razor, dry towel, and pair of scissors. When the AED arrives, you need to ensure the area is safe. Turn the AED on immediately by pressing down on the latch to open. Follow the AED prompts. Do not open the electrodes unless you have confirmed that the casualty is non-responsive and not breathing or showing signs of life. When you attach the electrodes, you need to make sure the chest is prepped properly. The gel on the pads requires very dry, clean skin. Excess hair needs to be removed. If the casualty is a female, you're going to remove the bra as well. Once the chest is prepared, place the pads in the proper position. Once the pads are in place and the AED is on, the AED will begin analysis immediately. It measures the electrical activity between the 2 pads and the heart and interprets if the heart is in a rhythm that needs to be shocked. When the AED is analyzing, make sure that no one is touching the casualty, as this will disrupt the analysis. Proceed as you are prompted by the AED. If the AED advises you to push the shock button, say the word clear, nice and loud to ensure no one is touching the casualty. If no shock is required, it will prompt you to start CPR and follow the prompts. If you are successful in your rescue, the casualty may start breathing on their own. Always make sure to reassure the casualty. Let them know what happened and maintain an open airway by putting them into the recovery position. Monitor the casualty until EMS arrives, but do not remove the electrodes as there is a chance the casualty may go back into cardiac arrest. You can turn off the AED. There are some special situations that change where you may place the electrodes. If the casualty has a pacemaker and it is under the area where the electrode pad would be, place the pad 3 to 4 centimeters away from the pacemaker. If you see any kind of medication skin patches, make sure you remove the patch wearing gloves so not to contaminate yourself, and clean the area with an alcohol wipe. If the casualty is pregnant, it is okay to use the AED. If the casualty is cold to the core, unresponsive, and not breathing, they are in a state of what is called hypothermia. This is the only instance where you will provide only one shock with the AED. Once you have done the one analysis where you are advised to shock or not shock, you can turn the AED unit off and continue with CPR until help arrives. The casualty in a hypothermic state must be warmed before anything can be done to help them. There are other safety concerns as well. Ensure you use personal protective equipment, for example, gloves. Avoid areas that have explosive or flammable agents. If the casualty is on snow, ice, or a damp surface, it is safe to use the AED. However, if they are in a large puddle, you can remove them from the puddle before using the AED. It is also safe to use the AED on a metal surface as long as the electrode itself is not touching the metal surface. Consult the manufacturer's recommendations if you have any other questions about safety concerns. If the AED fails, you can follow the prompts to troubleshoot. Turn the unit off, wait 10 seconds, and then turn the unit back on. Ensure the pads are connected correctly to the casualty's chest and that they are plugged in properly. If it is indicating the batteries are low and you have a new IntelliSense battery on hand, you can change it. If there is an AED failure and you are not able to troubleshoot, proceed with the rescue as if an AED is not available to you, continuing with your CPR. It is important to maintain your AED. There are usually site coordinators that are in charge of this maintenance. They should receive additional training for this. It is recommended to check the AED once a month. At this time, the status indicator is checked, as is the expiration date for the batteries and electrodes. Maintenance also includes management of AED rescue event forms, data downloads and software updates, troubleshooting and technical support, and reordering of supplies. There is a maintenance record that can be found on the HeartZap Services Health and Safety Compliance Program, which gives a checklist of things to look for. Ready for Rescue is the training program available through HeartZap Services. If you are interested in a CPR or first aid course, please visit the website listed. There is also an online blended learning first aid course that is available. The information about this is also available on the website. You can also call the main office at 1-866-764-8488. Thank you for your time. We hope this video helped familiarize you with the semi-automatic cardiac science G5 AED.